Well, next up, as I said, we traveled all over the county to look at different programs that are out there working. One of them is working strictly on a volunteer basis. It's the Caridad Clinic. Here's more.
Relax.
Inside this mobile van, Dr. Luis Feldgois uses the little bit of Spanish he has learned to make his patients feel more comfortable.
Los dos son borrosa. It had some help here, and because of that had acquired some eye examining equipment, but it really had been sitting in the corner of the minor surgery room covered up for several years, and nothing really was being done with it.
So with support from his peers, he set up a vision clinic and now sees patients just like he used to when he ran his own practice, only now it's for free.
Sometimes it's a little bit more intense because the patient population isn't necessarily in the best of health. So you'll see diabetic eye disease problems, you'll see further advanced cases of glaucoma than you would normally see in a private practice.
Barbara, you know, Caridad's whole mission is helping those that really have no way to get health care.
Yes, we were formed because we saw that there was a need in the community. The children of migrant families did not have any medical care or any means to get it.
Executive Director Barbara Villaseca believes the Vision Van is just one way Caridad must expand to meet the ever-growing needs of this community. Some of these people, like the ones we met today, they've never had just your basic letter chart eye exam.
Never, never. These people have never had the luxury of an exam by a doctor.
And with the health insurance crisis affecting more and more of the middle class, she knows it will put more pressure on this clinic.
Children need eye care. Diabetics need eye care. So it's very important to be able to provide this service, and we are providing it now once a week, and we're hoping to expand very soon.
Now, Caridad does run on donations and volunteers, as we said, and there's a difference there between what you do as far as the basis of it and what Caridad does. Why can't this work everywhere, was my question after visiting the clinic.
Well, they have a limited number and a scope that they fulfill. They would not be able to run that on a very large scale. We provide the sovereign immunity for those physicians, so we're working together, and the work that they do is tremendous. But it needs to be on a much larger scale. We have 7 clinics throughout the county. We see 55,000 unduplicated patients in the year 2007. So it's very large, and Caridad would not be able to handle that. So we're there as the last resort, like you said, for those patients who can't go elsewhere.
And Paul, we mentioned the last segment that it really does need to be this partnership. What will it take, though? I mean, that's a grand plan. The state and the federal government need to step in and help Palm Beach County. Will it take a change in leadership at both the state and the federal level? Will it take more county involvement and commitment? What will it take to actually make that happen?
Well, I applaud some of the leadership we've seen at the state level, both at the state health department, because our local health department is an arm of that state health department, and in the governor's office, where the governor has made an effort to try to get into play some more health insurance products in the state of Florida. But we haven't seen the same effort at the federal level. While both parties have been very supportive of the federally qualified health center, the community health center program, the reality is until we get a change in Washington, we're not going to see an overall solution to the problems we see locally. Yes, we will do great things by ourselves in Palm Beach County. The funding community will partner with the free clinics. We will partner with the health department. We will partner with the healthcare district. But it's just not fair to expect that either we can do it all or that the local taxpayers through the healthcare district can do it all. We have got to get the state and the federal government more involved in solving this problem at the national level.
And we talked briefly, the problem is growing. Can the health department, with obviously the support, really keep up with the demand? Because the day we were there was just a regular old day, and I was blown away when we walked in those doors by the need, by every chair filled, by children who hadn't seen a doctor, hadn't even had just your basic checkup. I imagine that's every day times 1,000, as Dr. Zito told us. Can you keep up with that pace?
Well, what we do, we've been cut just like everybody else. The state has made cuts for us. But what we're doing is we're trying to work smarter. We're trying to work more efficiently. We're trying to put in programs that will work better. We're trying to reach out to the community, such as this interview that you're doing with us, so that people know that there are available resources here in the county. Most people that don't have insurance have not gone for eligibility to see if they qualify. So there are many people working who actually can qualify. There are many programs, and maybe through programs like this they can tap into them.
And we mentioned the volunteer program wouldn't necessarily work at the big level that you're at. But we should mention that the volunteers at all of these levels, even at the clinics, are just key, Paul. They are key. There's people that, doctors especially down here, that have retired, that we met. Many of them are just dedicating and donating their time at these clinics, as well as at Care a Dad. How crucial is it not only to get tax money behind us, but to get volunteers behind these programs?
Well, we've had to. The volunteers here have been great, and I think that's one of the messages of the benefits of living in Palm Beach County, is that we do have many, many people who will volunteer, and we do have a health department, we do have free clinics, we do have the kinds of people in place who care about this issue in ways that we need to have them cared about. But the rest of us also have an obligation, I think, beyond what those volunteers do day to day, to make certain that we solve this problem over the long haul. My response to whether or not the health department can solve the problem here locally is, of course, it would have the capacity to solve the problem here locally if, instead of having 20 to 25% of our population uninsured, we only had 5 to 10% of our population uninsured, as is the case in many other areas of the country. So we need to work on that to help them not have too much demand for their services.
And I imagine that the other part of that is understanding the problem. You mentioned it earlier, but the actual number of how much it costs me, the insured employee, is almost $1,000 extra in my policy to cover those that are uninsured. So that's another reason to support the leaders that support more of this coverage and more of these programs, because literally it is costing each and every one of us that already have health insurance, according to the numbers that the Point of View documentary brought to us.
That's absolutely the case. Our health insurance premiums in Florida are dramatically higher for less coverage than they are in other areas of the country. Not because we're sicker in Florida, not because we're older in Florida, not because doctors make more money or hospitals get better reimbursement. They're more expensive for us almost entirely because we have many more uninsured people, and they don't get treatment for free. It doesn't cost nothing to treat an uninsured person. It costs something to treat people, and so those costs get slipped over, and it is a tax. It may be considered to be a hidden tax by some, but it's a real tax, and businesses feel it.
Everyone feels it. Thank you both for joining us. We're going to have 2 more panelists, but you've been excellent. Thank you so much.